Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca.
Hello everyone, Happy New Year and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. This month, the Spark theme relates to immunization. I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin and Anishinaabe people. We recognize and deeply appreciate their historic connection to this place, and we also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community, our province, and the country. Today, during our Immunization Month, we are delighted to bring you COVID-19 vaccines in children with medical complexity and/or disabilities. And now I'd like to introduce our three phenomenal speakers for today. First, we have Dr. Eyal Cohen. Dr. Cohen co-founded the Complex Care Program in the Division of Pediatric Medicine at the Hospital for Sick Children, where he is program head of Child Health Evaluative Sciences in the Research Institute. He is a professor of pediatrics and co-director of the Leung Center for Healthy Children at the University of Toronto, with cross appointments in the Institute of Health Policy, Management, and Evaluation. Next, Dr. Julia Orkin. Dr. Orkin is a staff pediatrician in the Division of Pediatric Medicine at the Hospital for Sick Children, where she's medical director of the Complex Care Program. Dr. Orkin is also the pediatric clinical lead for the Ontario Health Toronto region and is medical lead for the Sick Kids Community Outreach Program, which includes COVID-19 testing and vaccination programs, including the COVID-19 Vaccine Confidence Hotline. Dr. Orkin holds an associate scientist track position at the Sick Kids Research Institute and is an associate professor at the University of Toronto. And her research interests focus on innovations in care delivery for children with medical complexity and their families. And finally, I am delighted to introduce you to Brenda Lenahan. Brenda is a mom to a young son with complex disabilities who has inspired her involvement in advocacy research and her home-based business selling adaptive outdoor recreation equipment. As a partner and patient advocate for a grassroots group, Brenda founded BC Parents for Complex Kids in 2017. She advocates for access to equitable supports for kids with complex disabilities and medical complexity. And Brenda works with the Child Right Network as a partner on various research projects and initiatives in the hopes that one day the research can inform needed policy changes both provincially and federally. And Brenda has an optimistic heart and a hopeful vision on an equitable future for her son and all persons with disability in Canada. Just a reminder that we record all our webinars, and as mentioned in the introductory video, please type your questions into the question box at any time, and I'll prompt you via the chat as well. And I'll pose your questions to our guest following the presentation and panel discussion. It's now my pleasure to pass the mic to Brenda.
Good morning, everybody. I'm speaking to you today from the territory of the Moa-Chuk-Mushklet First Nation on the west coast of present-day Vancouver Island, where it is early and still dark out. First off, I'm grateful to be here today, and I want to acknowledge that the reason I'm here on this panel is because Children's Healthcare Canada and my fellow panelists have prioritized ensuring family voices are forefront in today's discussion and in their daily work. And I know that as a parent, I really appreciate this movement towards partnership and authentic child and family-centered approach to care for complex kids. I've been asked to share a little bit about our group here in BC, which is actually now called BC Complex Kids Society. We were incorporated this summer in July, and how it came to be. So, there's a lot of Facebook groups that are generalized for kids with disabilities, but myself and others saw and felt the need to come together. We're kind of a unique demographic, and to come together to share our experiences, our knowledge, and also to advocate for improved systems of support for our kids. And the Facebook group started in 2017, and it has been really quite a phenomenal experience, actually. Moving towards the topic of the day, I'd like to share a bit about sort of my perspective and experience through the pandemic. And I know there's a lot of parents here today, so this is a shared experience that we've faced a disproportionate impact throughout this pandemic as most of our kids have 24/7 support needs, and we're already under supported by schools, unmet nursing needs, lack of respite funding, and lack of support in daycares. So, through the pandemic, as we've been trying to assess risks for our kids with very little insight into what the actual risk is, and then often erring on the side of caution and shielding our kids at home, meaning lack of missing out on work opportunities and just living in a state of concern and fear for our kids, their health. And a lot of our families were also already experiencing financial instability. So there's definitely been, a real compounding effect through this pandemic. So now to the topic of vaccination rollout, many of us have been anxiously awaiting the rollout of vaccinations across the country for our kids. Some of our older kids got vaccinated over the last 6 months, and myself, I have a 7-year-old son, and he just had his first shot in December, and we're getting close to shot number 2. But I think a lot of families have been anxious, although I'm sure there are some that have been hesitant. And I think some of the hesitancy has been around their children's particular health condition or medications that they take. And it's been for the most part, I think families have been really excited to move on to this next stage where we can feel a little more comfortable and confident that our kids have some protection. We've also done a lot of advocacy through the pandemic, trying to get prioritization for ourselves as caregivers, and for our kids. I think that rolled out differently across the country. I think possibly some areas did prioritize parents as caregivers, but yeah, for the most part, we've been doing a lot of waiting and having to be very patient. So that's a little bit about my experience and what I see around me with other families. And now I'm really excited to hear the presentation from Dr. Cohen and Dr. Orkin. Thank you so much.
Thank you, Brenda, for those words and for all the work you've done in advocacy throughout the pandemic and beforehand, and really appreciate your partnership today in this conversation on vaccines for children with medical complexity and or disabilities. So just a few comments. Anytime you speak about anything related to the pandemic, it's really important to say that whatever we speak about today, there will be new information that will come fast and furious, and some of what we say today may change. And if you're always looking for the latest information, try to utilize reputable sources. The Public Health Agency of Canada has an excellent website that is linked on this slide. And we're going to only talk about one of the vaccine products today, which is the Pfizer mRNA product, because that's currently the only vaccine product licensed for children in Canada. So Dr. Orkin and I have 3 goals today. We're going to talk a little bit about COVID-19 illness and vaccination with a specific focus on children with medical complexity and disabilities. We're going to try to explore some of the common questions related to COVID-19 vaccination and try to leave some time for Q&A with all the participants who are kindly joining today. So this is where we're at in the pandemic in Canada as of a couple of days ago. So as probably everyone on the call today knows, almost all of Canada is in a pretty substantial surge at the moment from a new variant of the SARS-CoV-2 virus that's called Omicron. And right now in Canada, virtually all COVID-19 cases are Omicron. There's still a smidge of Delta left over, but almost all of the viral activity in Canada is due to Omicron. And children are getting infected now with this variant more than previous variants. Earlier on in the pandemic, children were actually a minority of a pretty substantial minority of cases, but now that is no longer true. About 21% of cases of COVID-19 in Canada are now affecting children. Over 500,000 children have been infected. Fortunately, outcomes for children in general are better than they are for adults. So only about 2.5% of hospitalizations nationally are due to COVID are in children. And there's a lower proportion of children who suffer from more severe outcomes like ICU. And in rare circumstances, unfortunately, death as well has been described in COVID-19 in Canada. So that's where we're at in terms of COVID-19 in children. Where are we at in terms of vaccination? So these are the latest data in Canada. And what you can see here is that for children 12 to 17 years of age, we're actually doing pretty good nationally. About 87% of children have received 1 dose. This is data as of a week ago. And 83% of children 12 to 17 years of age have received both doses. But the group we're going to focus probably the most on today is the 5 to 11-year-olds, where the vaccine was just approved in November, and the numbers are lower. So the latest data are about half of Canadian children 5 to 11-year-olds have received 1 dose, and a much smaller proportion have received 2 doses. And there's quite a bit of provincial variation. So Newfoundland has much higher rates than other provinces in Canada. The rates are a little bit lower, particularly in the western provinces like Alberta and BC. But as a whole, it's about 50% nationally. So amongst children, I mentioned that children are at lower risk of severe outcomes. Which children are at increased risk? So I'm going to talk about 2 quick studies. One is a paper that was published using Canadian data of 264 children admitted to hospital across Canada. And just a couple of comments. You may read in the media a lot of stuff about our children, our cases in hospital with or because of COVID. It's actually not that straightforward sometimes to separate the two, but there are some children who are admitted to hospital for other reasons who are incidentally found to have COVID because we screen children when they're admitted to hospital for SARS-CoV-2, the virus that causes COVID. But many kids are in hospital either due to direct infection with COVID or complications of an underlying chronic disease that are triggered by COVID. And the group that's at highest risk of hospitalization amongst children, first there's an age risk factor, so young infants in particular are at risk, and adolescents are at risk. of being hospitalized, a little lower risk among school-age children, but the risk is definitely there. And there's certainly risk factors associated with chronic diseases. So that's very relevant to our discussion today. So children with chronic respiratory, neurologic diseases, and obesity have been described as being at risk in Canada. These data are from the United States and also show something similar, that many chronic diseases are associated with more severe COVID disease, in particular from this particular study with over 1,500 hospitalized children and youth in the United States, being fed through a G-tube, having diabetes, having obesity, are all known to be risk factors. Interestingly, not all chronic diseases are risk factors. So, at the beginning of the pandemic, people were really worried, for instance, about children and youth with asthma, children and youth with cancer, and a few other diagnoses have not borne out to be major risk factors. But certainly, children with chronic diseases, many of whom have medical complexity and/or disabilities, have an increased risk of more severe outcomes. I don't know about you, but I actually found sometimes interpreting risk really, really complex in today's day and age. These are increased risks, and they are, not trivial, but compared to some other risk factors, for instance, age, these additional risk factors in children are relatively smaller. So even amongst children who have risk factors, fortunately, most will do well with if they get infected with COVID, but we have to be really aware of those at increased risk. And I had mentioned before the data on vaccine coverage. I apologize. I'm going to use an Ontario-centric slide here, just because there are good data on this from Ontario. In Ontario at the moment, 45% of children 5 to 11 years of age have received at least one dose of the vaccine. But I find this somewhat troubling. When you look at vaccine uptake by chronic diseases, many of the groups of children who we know are at increased risk of more severe outcomes actually have lower vaccine uptake than the provincial average in Ontario. So on the far right of this graph, you see children with tracheostomies or children who have compromised immune systems have a lower actual uptake of the vaccine than the provincial average, which is encompassed mainly, obviously, by healthy children. There are some groups of children with chronic diseases of which the vaccine uptake has actually been really good. The one I'd like to highlight in particular is the inflammatory bowel disease population. And I think there's many, many reasons why this is the case, including some excellent advocacy work by the Crohn's and Colitis Canada and other advocacy groups who have been promoting vaccine uptake in these populations. But on a whole, I do find this kind of information somewhat troubling, because we really need to do a better job of reaching out to the groups who will benefit the most from vaccination. So where are we at with vaccinating 5 to 11-year-olds? This is a slide, and you see on the bottom right, one of our co-speakers today, Dr. Orkin, who I think gave the first vaccine to children in Ontario at the launch of the vaccination campaign back in the late fall. And we're really trying to move forward and promote this for children at the moment. These are the current recommendations from the National Advisory Committee on Immunizations, otherwise known as NASI, which is that a complete series of the Pfizer BioNTech COVID-19 vaccine at a dose of 10 micrograms it should be offered to children 5 to 11 years of age who do not have contraindications to the vaccine, with a dosing interval of at least 8 weeks between the first and second dose. Now, we'll speak a little bit about this later. A couple of quick points. It's 10 micrograms, which is a smaller dose than is given to older children and adults. The adult dose is 30 micrograms. Contraindications are very, very rare. Essentially, the only really important contraindications to getting the vaccine is being allergic to something in the vaccine, and or having had a reaction to the vaccine that causes something like inflammation of the heart. But the contraindications to the vaccine are very, very rare. And the dosing interval of at least 8 weeks Some jurisdictions in Canada have allowed parents to receive the vaccine at an earlier interval than 8 weeks, but the recommendation by NASI at the moment is 8 weeks. And I'll talk a little bit about that in a minute. So in terms of the benefits and the risks of the vaccines, we're going to go in some detail about each of those. I'll begin by talking about benefits, and then Dr. Orkin will talk about potential risks associated with vaccinating children. So the big benefits are reduction in the risk of infections, complications, and severe disease. And three particular things parents and healthcare providers are concerned about. One is acute infection and severe disease, so having like a bad pneumonia from COVID-19. The second is of a syndrome called MultiSystem inflammatory syndrome in children, which you may hear called MIS-C, MIS-C. And the third is long-term sequelae, and we'll talk about each one of those. So the study on which licensing of the vaccine was developed from was published in the fall and looked at the Pfizer product in children 5 to 11 years of age. And what they looked at was the safety, immune response, and efficacy of the vaccine. And they found that that 2 doses of the vaccine were over 90% effective in preventing infection with COVID-19. So highly effective against preventing infection. Over time, we've looked at real-world data. Again, these are from Ontario, but there have been similar data published in other jurisdictions. And this also includes some data about Omicron. So what we know with Omicron is the efficacy against getting infected is a bit lower, right? There's still protection against infection, but it's not the same protection against infection that existed with earlier variants like Delta or Alpha or the original SARS-CoV-2 vaccine. But protection against hospitalization and severe hospitalizations, like ending up in the ICU, is still pretty strong, even with the Omicron variant. So you see this nicely illustrated in this graph that comparing unvaccinated and vaccinated individuals, this is mainly adults, but the same is true in children, that you see that there is some protection against having COVID-19 cases, lots of protection against hospitalization, and even larger protection against ICU. And the later dates in the graph below are the time in which Omicron has taken over, and you still see lots of protection against hospitalization and ICU admission with vaccination. In terms of these other two things that are particularly relevant for children, so multi-system inflammatory syndrome in children is relatively rare, but can be very severe. Children who have this have inflammation of many organs in their body and often need ICU care. It's estimated to occur in about 1 in 3,100 children. So that's one important outcome that we think about a lot. The other one is what's been dubbed long COVID-19, or a post-acute phenomenon. So after you have the infection, having long-term symptoms after the infection. That's been very well described and does occur in children, including those with mild illness. It's a little bit challenging to actually understand how common it actually is. We do think it has much lower rates in childhood than it is in adults. And people who have been following patients with long COVID-19 have said that most of them seem to get better over time, but it's still an important consideration in terms of trying to prevent children from getting infected with COVID-19. So what do we know about some of these complications of COVID? We know the vaccines work really well. So the figure on the left is a study from France, and there's been other studies that have shown that MIS-C is very uncommon in children who are vaccinated. There's over 90% reduction in the incidence of MIS-C, this multi-inflammatory syndrome, amongst children who are vaccinated. And the figure on the right is data that came out last week from the state of New York, looking at children who are hospitalized with COVID-19 in this Omicron wave. We have seen more children hospitalized in this wave than we have in some of the previous waves, but the majority of children who are hospitalized are not vaccinated. Of course, that's true of those under age 5 who cannot be vaccinated, but amongst those who are eligible for vaccination, 5 to 11 years of age and 12 to 17 years of age, they're much more likely to be unvaccinated than children who are in the community in New York State. So really good data to suggest that the vaccines protect, even during Omicron, from hospitalization. The second reason we vaccinate is to reduce transmission of the infection to others. And that has important implications for safety of school, for safety of children's activities with caregivers or vulnerable family members or teachers or other members of the community who may be at risk of having severe infections with COVID-19. So that's a second really important reason we vaccinate. And the third one is, to summarize very simply, it's to let kids be kids. There's been no doubt that the pandemic has been a huge struggle for children and youth in Canada, including children with medical complexity and those with disabilities who've had severe restrictions on their education, on their ability to participate in extracurricular activities, and to do other things that kids need to do to be kids. And the more people we have vaccinated and the more immunity we have, the more we'll be able to support children and youth from doing the things they need to do. So I said I'd come back to this point around the recommendation that NASI made of dosing 8 or more weeks between the doses. The rationale for that has been that there's good data to suggest that when doses are spaced a little bit more than the 3 weeks that Pfizer did in their study, we think that immunity lasts longer, resulting in more effectiveness of the vaccine. There's also some suggestion that a very, very rare side effect that Dr. Orkin is going to speak about of myocarditis, which is inflammation of the heart, is lower with an 8-week interval. Again, as I mentioned before, in some jurisdictions, it's allowed to give the vaccine at a different interval, for instance, at 4 weeks or 3 weeks. And that is a discussion that can be had with a provider about the risks and benefits of doing 3 weeks versus 8 weeks. But the current guidance nationally is still to use an 8-week dosing interval. So on that, I will pass on to Dr. Orkin to speak about potential risks of the vaccine.
Thank you very much. And thank you, Dr. Cohen. It's such a pleasure to be here with all of you today to talk about two of my most passionate topics, children with medical complexity and disability, but also the COVID-19 vaccination. Because really, when you think about it, there isn't a lot that we have, unfortunately, throughout the pandemic that we can really say makes a difference. And I'm hopeful today that we will be able to share with you the benefits, but also really go through potential risks. Because I know as parents, as caregivers, as friends and family members, we do worry when we're making decisions about vaccination. And next slide, please. Dr. Cohen, do you mind going to the next slide? Sorry. So we already heard about the Pfizer trial. So the Pfizer trial for 5 to 11-year-old were able to actually look at both short-term as well as common and less common side effects. And so one really important point is that there was actually no reports of anaphylaxis, so severe allergic reaction, and no reports of myocarditis or pericarditis within the trial. We have the benefit now of over 8 million children across the US, Canada, who have been vaccinated with the Pfizer COVID-19 vaccine. And once again, myocarditis and pericarditis are extremely, extremely rare. And currently, in over those 8 million children that have been vaccinated, there's less than 10 clinical case reports. In terms of the most common side effects, there actually really were limited, even less than the age 12 plus. Most common were, difficult, sense of discomfort in your arm, maybe a little tired, but even fever was not a commonly reported symptom. In terms of the myocarditis and pericarditis, so for those of you on the call, myocarditis is inflammation of the heart muscle. Pericarditis is inflammation of the sac or the lining around the heart. And the concern initially was that when your immune system gets activated because of infection or vaccination, it can sometimes get confusion in the immune reaction. And so really what we can then see is this inflammation that is occurring in the heart. The most important thing to know, though, is often in these clinical conditions that were reported, most children did not require hospitalization and were treated with supportive care. And and NSAIDs, which is another word for ibuprofen. So we're really self-resolving most of the time. And the most common time for them to occur in the literature was really within the first week from vaccination, more commonly with Moderna vaccine, which is not used in children, and also following the second dose in a shorter time interval. So that is really, important to know when the majority of children aged 5 to 11 are approved for Pfizer, not Moderna, and the time interval is actually longer, which all prevents against the risk of myocarditis and pericarditis. And once again, the case count or the risk is less than 1 case per 10,000, and that's in the older children and adolescents and young adults, and not in the younger children. Next slide. And so once again, to highlight, the reporting rates are extremely low. Once again, highlighting, and for many of those individuals that have concerns, we hear often around patients that we care for that children have underlying heart conditions. They may have been born with a congenital heart defect or other condition. That in and of itself does not put you at risk for myocarditis and pericarditis. In fact, the COVID-19 infection, getting an infection from COVID-19 is actually much higher likelihood of getting myocarditis or pericarditis after the actual infection than the vaccine itself. So that's more information that's really important for individuals to know. And once again, it's showing you here in this table, the rate per 1 million doses. So in the 5 to 11, 4 cases, out of 1 million, and only after dose 2. So next slide. So what about longer term side effects? It's really important to know that the mRNA vaccine technology actually does not live in your body. It actually gets degraded, and the estimated time is roughly around 6 weeks after vaccination that it actually is gone from your body system. So therefore, vaccine side effects are very unlikely to occur after the 6-week time point. And vaccines are eliminated quickly. It does not actually go into your DNA or your genes or your cells, and it does not build up in your body system like a medication. And at this point in time, there's actually no long-term consequences associated with any vaccine that we know of, because once again, as you see, and in the concept of the requirement of boosters and the requirement over time, that your immune body does sometimes need reminders. And we'll understand that more as we go with the ability to monitor signals in the community over time with vaccination. Next slide. So the confidence in our safety data. So, many people say, well, how do we know it's safe? It only, been around for a little while. Well, the answer is that the clinical trial that was done really is important to tell us. Number one, it's effective. 2 doses of the Pfizer vaccine is effective to have over 91% protection against COVID-19 and immediate safety, which is really important when we're considering the risk-benefit ratio to an individual. As well as you saw on Dr. Cohen's slides, it may not prevent infection, but really, the importance of prevention of hospitalization, severe disease, and long-term outcomes of COVID-19 is really the goal here. It is difficult to pick up more rare adverse events, and that's the importance of tracking and surveillance systems that are in play across our country. And once again, the real world experience is extremely important, and it helps to inform how we make decisions around dosing, dose interval, and timing. And once again, robust ongoing surveillance is a part of vaccine delivery to ensure that serious side effects are reported and action is taken immediately if there is concern. Next slide. So a few common questions that we hear, we thought we'd include today. So the first question is, should my child be vaccinated if they've already had COVID-19? And the answer is yes, they should be vaccinated. And here in Ontario and other jurisdictions, we recommend 2 doses of the vaccine still, even if an individual has had COVID-19. The reason is that we don't know what your individual body's immune response would be to that infection itself, that we need individuals to have a systematic and controlled immune response in order to prevent COVID-19 in the future, in order to be confident that it is effective. And so there are scenarios where we would say, wait for your vaccine. So the one scenario would be if you're acutely unwell, if you're still in your quarantine or your infectious period, you still have symptoms or you're completing your quarantine, you should not be vaccinated during that time period, but you should wait and follow your local public health guidance in terms of safety for vaccination. The second scenario is a child who has a history of the MultiSystem inflammatory condition. The current recommendation is to wait at least 90 days from the diagnosis in order to ensure a good immune and robust immune response to the vaccine. Next slide. Should the vaccine be based on weight? We have many families asking us who are concerned that their child may be small or may be underweight, and that may affect how the vaccine responds, or should they get a lower dose. And the truth is vaccines are very different from medications, which are often weight-based. They're not actually distributed throughout the entire body through your weight. And so weight-based dosing is not required. It's based on the immunity, your immune system and the maturity, which is based on your actual age, so your chronologic age. So we know that children who are age 5, doesn't matter their size, will respond appropriately to the vaccine dose, the 10 microgram dose, as you heard from Dr. Cohen. Next slide. Should my 11-year-old wait to get the higher dose? So we know that the 12 plus has the 30 microgram dose recommendation, and the 11-year-olds have the 10 microgram recommended dose. And the first thing that I would say is it's really important to get the first vaccine that is available to you. So we do know that many people were concerned early on and wanted to wait until their child was older to get the higher dose, with a conception that maybe it was stronger, maybe it would be more effective. And the answer is that's actually not the case, that you should really get the first dose that is available for you or your child in order to ensure protection. What you can see here in this graph is that the larger color, the green, the pink, the gray, the larger bar actually shows over time the immune response to the vaccine. So the 10 microgram vaccine. So a 5-year-old, a 7 to 8-year-old, a 9 to 11-year-old, their big bar is relatively the same at post-vaccination 1 month. So you can see that their immune response is equal across all age groups, and that the 10 microgram dose is sufficient. In fact, they did give the 30 microgram higher dose to younger children, and they actually found no benefit in terms of immune response and just more side effects. So it's really important to recognize the risk-benefit ratio there in terms of immune response and minimizing side effects. Next slide. So how can I help my child prepare for vaccination? It's an extremely distressing time for many, adults included. So here are some tips that might be helpful for you. Next slide. We know that vaccination in and of itself is a very quick procedure, but often the anticipation, the preparation, the readiness can actually make a big difference in the experience. And so one approach you can use is called the CARD technique. And so it stands for comfort, ask, relax, and distract. And these are some techniques and tools that you can use to help yourself or others during the vaccination. So comfort, find ways to be comfortable. That may mean lying down, wearing a t-shirt, having it in a certain setting, or deciding where you choose to be vaccinated based on how you think it may go for you or your child. Ask questions. So, inform the individual who's going to be vaccinated, or use tools such as storyboards or others so that they know what to come or what to expect from the day of vaccination. And then use techniques for calming. That might be listening to music, bringing, distraction techniques, an iPad or earphones, depending on the individual. And then often distracting the information, the attention to something else, a big hug, a squeeze, sitting on your lap, or other approaches. Next slide. So here are some tools, for example, that just go into, techniques that you could use, taking slow deep breaths, positive self-talk, like tell yourself you can do it, have someone to support you, and then distraction ideas. Next slide. So some of the things that, these are some pictures that we use at our vaccine clinic here at Sick Kids. We have Fidget Toys, which are really helpful, squeezy balls, iPads, a Find It toy, which is just something to look for. That really just takes your mind off the moment. We're also starting to use some virtual technology, which will actually distract individuals using really neat animation. Next slide. And so tips for children with developmental disabilities, this is actually really helpful. And the link is here for others to look up, but it gives some ideas that you may want to share with the vaccinator depending on you or your child. So things that I find difficult, it may be that you require accommodations for the vaccine that maybe the vaccinator or the clinic hadn't thought about. So thinking through what may help to make it the best experience it can be. Keeping quiet, noises, bright lights, too loud spaces, maybe even seeing the needle or not wanting a Band-Aid are really important considerations. And then ideas of how you can help the individual to think through or tell the vaccinator, what would be helpful. Let them hold my hand or sit a certain way, or put pressure or no pressure, or talk or don't talk. Some of those can be very helpful. Next slide. So how can we increase vaccination? So one concern, I think, and why Dr. Cohen and I are so happy to be here today is that we care for many children with medical complexity. And when we hear and we talk to individuals, we often do hear that there's, number one, misinformation, two, a lot of true and real concerns and questions that we hope we can answer, because we do know that the vaccination rate to 5 to 11s is low. Here in Ontario, it's, at just about 50%. And we know that our children that we care for, who we see in hospital, really deserve to have all the answers and their questions explained and explored. So we know that talking about it helps, education support helps, and then providing the right opportunity for vaccination, whether that's in a school or hospital or special clinic or primary care, to make sure it's the right fit. Next slide. And so what we have here in Ontario was launched a Sick Kids COVID-19 Vaccine Consult Service. And I've had the opportunity to work with some incredible individuals leading this team. And so we support residents in Ontario that are open to exploring with other provinces the ability to engage and learn from our experience, that parents, caregivers, legal guardians, or the youth themselves can call to ask questions related to the COVID-19 vaccine. Often, if they can't find the question or answer somewhere else, they may have unique questions about their own child's illness or themselves, and that we can provide the link to specialized clinics to actually support them, not just with information, but directly related to accommodations or needs, like significant needle phobia or in other specialized behavioral developmental conditions. Next slide. The vaccine consult service is available in any language. It's a self-booking system, so individuals actually book it online themselves, and they first speak to a Sick Kids nurse who specializes in vaccination information. It's a non-judgmental, safe space for questions, concerns, and discussion. And the goal is for validation and understanding. It's not there to force or coerce anybody. It's really discussion and understanding where that individual may be. Certain individuals have further questions, concerns, or medical needs that require escalation, and further consultation can occur with a physician like myself or nurse practitioner, or referral to a special immunization clinic or allergy clinic, depending on the concern. Next slide. So what you can see as of January 7th, we've completed 948 appointments. We've had the opportunity to support and 93%, the majority is with parents and caregivers calling about their children. And you can see that, the breakdown here, a good number of individuals calling around 6 to 9, up to 12, and even some individuals preparing for when their little ones are eligible for vaccination. Next slide. The most common concerns we have are actually related to pre-existing medical conditions. Most individuals are calling about my child has this condition or that condition. How does the vaccine affect them because of that? As well as around supports for vaccination and specialized services. The questions I answered before around short-term side effects, risk of myocarditis and pericarditis, the development and safety of the vaccine are some of the most common questions. Once again, the nurse who is the first point of contact really does answer the question for the majority of patients. Only 13 patients have been referred to a special immunization clinic. 2 have been referred to an allergy clinic, and almost 100 calls, 93 to the physician or nurse practitioner. That's almost 900 calls supported with the nurse through education and time and discussion. Next slide. So this is our feedback at the end of the call. We have just over 80% intend to vaccinate their child. About 15% are still undecided and also want to take the information back to think and discuss a little bit further. Our satisfaction, is very high, and we're very, grateful that individuals will call and spend the time with us to really understand and explore. Next slide. So with that, it's been a pleasure today, and we hope that we can answer some of your questions.
And I think at this point, we'll have a roundtable question and answer with Brenda, Eyal, and Julia. And then we'll move on to the many questions that have come in through our Q&A and or chat box. Brenda will be posing the questions on behalf of herself and parents that she's heard from through her group in British Columbia. And Julia and Eyal may have some questions for Brenda as well.
Sure. I'll start with one that's, I was going to ask, and I see also in the chat there in the questions, just looking at a couple, wondering when we're going to see the approval come through for boosters for under 18, and also wondering about children under 5 and where that sits in terms of whether we're going to see that come through soon for kids under 5 to be able to get their vaccinations.
Maybe I'll start, Dr. Orkin, if you want to add. I think NASI, the National Advisory Committee on Immunization, is currently reviewing the data on boosters for children aged, for adolescents and children above age 12. It has been approved in the United States, so we should have an answer soon, I think, in Canada, one way or another. I think, again, I just want to reemphasize that 2 doses provides quite a bit of protection. So I think it's an important question to answer whether it adds additional protection. But if we had more youth vaccinated with 2 doses, that still is a major focus for the time being. In terms of children under age 5, Pfizer had a trial of a smaller dose, I think 3 micrograms of their vaccine, that had an insufficient immune response. So unfortunately, there's been a bit of delay on their end in finding an efficacious product for the age group under 5, but they still have lots of rigorous ongoing work going on. And similarly, the other vaccine company that makes mRNA vaccines, Moderna, has a trial that, including in Canada, that goes down to age 6 months. So the thinking is we will likely have an answer from those 2 trials by the springtime. So that is the likely time frame for when we'll have a product available for children under 5. I know that might sound a little disconcerting to some or many on the call, but again, there's still many things we can do to protect those under age 5, including ensuring everyone around them is immunized themselves and doing the other public health measures that have been recommended for us during the pandemic.
Absolutely. Thank you. And also thank you. Sorry, I forgot to thank you for the awesome presentation. It was really informative. In fact, there's a lot of information in there that, really helps with the risk assessment. And there's some research I hadn't seen before. I'm really interested in the piece about, the kids that are at risk of an increased risk of serious disease, the feeding tube dependence and diabetes type 1 and 2, specifically the feeding tube dependence and how that relates. I mean, I guess that, I'm just interested in hearing a bit more from you about that piece.
Sure, maybe I'll start and Dr. Cohen can add. I think in some ways, there's a few things. The first is what I don't think it's necessarily the feeding tube in and of itself, but that the feeding tube is a marker of underlying chronic conditions. And that really, any child with an underlying chronic condition is at risk with viral illness itself. So whether that's influenza, RSV, COVID-19, the likelihood of that individual requiring hospitalization or ICU level care to get over that viral illness, that in another child, that other child may just, be a little bit under the weather for a day or two. So that fragility is what the feeding tube is a marker of. And so I think what we're hopeful for, and this picture is one of our patients and his mom, just really trying to hope to get the message out that the risk of COVID-19 infection far outweighs any risk of the vaccine. And so this was our Sick Kids Complex Care Vaccine Day. And I think that's what the feeding tube is a marker of, underlying fragility and underlying risk for COVID itself.
Absolutely. It might, I would love to take some of that information and see it sort of shared in terms of more broadly. So folks can look at some of the information you shared today, maybe in an easy to share format. That would be helpful. I also wondered about I think it's wonderful you have the vaccine consults service in Ontario. And I wonder if you're seeing, are there other services like that across the country in other provinces? And, if we call Ontario, from BC, are we going to be able to have a chat, or how does that work?
So we don't ask you or limit, but that's between you and I. If you call in secret, we're not going to turn you away. But I think this is the opportunity to highlight how important this consult service is. So there's nothing magical about Ontario. Every other province could do something similar if there's benefit, and we would be so happy to support our learnings and share broadly. It's been an incredible opportunity to see the difference it can make for families.
Yeah, absolutely. I think that could really help with answering questions. It's very hard to see or connect with our, pediatricians and other physicians right now. So that could be very, very helpful. I wonder if we're going to go to some of the other questions in the Q&A. Should I?
Sure. Could I ask Brenda? Brenda, I have a question for you if you're comfortable answering one.
Sure.
What do you think it would take for us to support, I think you already mentioned, maybe easy to digest information, but how can we support our families? Often I'll have a regular complex care appointment with a family and they are not vaccinated or their children are not vaccinated. And we have, a conversation, but what else could we do so that broader message is shared?
I'm not sure. For the most part around me, I see people that are anxious to get vaccinated and to get their kids vaccinated. But I think really just sharing what you shared today, but specifically the pieces about the increased risk for certain populations and the benefits of the vaccine, if we could find a way to share that in a really in a broad way in pretty short order, I guess would be really helpful because, I just read on Twitter this morning that there's 80 kids in hospital in Ontario, and we haven't really heard those numbers until now. And we haven't had those numbers till now, but we're here now, and we need that sense of urgency to be on the table, I think. Yeah.
Are there other questions, Brenda, that you wanted to ask, or shall we move to the Q&A?
I think it would be good. I think it would be good to get into the Q&A and see what the folks in the audience are asking.
Sure. So one question, for a child with a history of stroke and or blood clots, are they at higher risk for the vascular side effects of the vaccine?
So maybe I'll start. So the risk of vascular events was described not as much with these products as with a different product. There was a product made by a company called AstraZeneca, which is and another product made by a company called Johnson & Johnson that have been associated with clotting events I think it's only been described in adults because they're only licensed in adults. But I don't believe that there are any known risks of clotting from the Pfizer vaccine, and it's certainly not a contraindication to getting the vaccine.
Great, thank you. Another related to a child between 12 and 18 who has autism and epilepsy and has received her first 2 COVID shots, due for a booster. There are some concerns around retaining protein levels. Question was whether or not it was safe and effective to receive a booster if her protein levels are lower or her immune system more compromised.
I can start. So what we actually do know is that if you have an underlying immune deficiency, I don't know if in this individual case they do or do not, but those who are classified as having moderate or severe immune deficiency actually benefit more from boosters, because what actually happens is they need a second, third, potentially even 4th dose to mount the same immune response. So the booster is actually essential to get the effectiveness of the vaccine, and it's not considered a risk. Your body actually needs that additional dose in order to mount the correct response. So right now in Ontario, those who are considered moderate to severe immune deficient or on immune suppressant medications are eligible for boosters. Even if they're 5 and up. So that is currently the recommendation. For those individuals who are not considered moderate to severe immune deficiency, so either those who have an underlying immune deficiency or on immune compromising medication, are not yet eligible, but we hope soon, because many consider, underlying fragility as a risk factor. So we're hopeful that more information will come shortly.
Thank you. And another question, if the vaccine doesn't prevent the transmission of COVID, do we know what the likelihood of its impact on long COVID is? And my assumption, but I could be wrong, is that we don't know yet, but I'm interested to find out too. So does the vaccine have any impact on long COVID in children?
Yeah, so that's an excellent question and a difficult one to answer, because as I didn't go into great detail, long COVID, the description of long COVID has been challenging. The diagnosis of it, we don't have standardized criteria that everyone has been using to diagnose it. I did come across something yesterday that was a study that was published as a preprint that showed that vaccination reduced the frequency of long COVID. And we have every reason to believe that that makes sense, because every other complication of COVID, the vaccine seems to be decreasing the risk of. So we would expect that we will see a decline in long COVID amongst vaccinated people. But again, with all these new emerging variants all the time, every single time a new variant comes along, you need to really think about the information independently. But again, I think the likely scenario is that's what we're going to see over time with the data.
Oh, great. We have a couple more. There's a whole queue of questions, and Dr. Cohen has thankfully agreed to respond to some of the ongoing questions that we'll share with him after and post on our Knowledge Exchange Network page that I shared in the chat box. So I'll take a couple of more questions, then we have a quick poll and we'll round out. Let's see. Have you heard any news about the Quebec vaccine, Medicago, for children? Does anybody know how it compares to Pfizer and Moderna and when we might see it?
Yeah, so we're in an era of information by press release, and I try to focus in conversations like this on things that have actually been released publicly in terms of data, and I have not seen anything published on this product, although I've seen news media reports on it, so I don't think I can comment. Dr. Orkin?
I agree, and it's actually part of the challenge right now is where is reputable scientific evidence, and I often encourage individuals to actually have certain websites bookmarked. So our SIC is www.aboutkidshealth.ca, and we can share that afterwards. We actually update our information every week with most common questions and data regarding COVID-19 vaccination, as well as kidshealthfirst.ca is another website. So I would really encourage individuals to use those reputable sources or your local public health unit or Ministry of Health for information.
Fabulous advice. So we will share the questions with the panel after this session. If yours didn't get answered today, check back on the website. I just want to thank all of you, Dr. Cohen, Dr. Orkin, and Brenda Lenahan, for sharing your time and expertise with us today. We're so privileged to have each of you and your unique perspectives and sharing them with our members. Thanks to all the members and other attendees who chose to join us. We know how busy you all are right now, and we hope you depart with some practical knowledge to bring back to home or to your organizations. Join us for the rest of our January Spark content. On Wednesday, January 26th, we'll have telerehabilitation for children and youth with disabilities, evidence and perspectives, with our guests Tatiana and Annette from ChildRight. In the coming weeks, we'll also be releasing a new episode of Spark Conversations, getting the message across, clear communication during the COVID pandemic with Dr. Krishana Sankar from Science Up First. And finally, don't miss our upcoming major event for healthcare providers next Thursday, January 27th, as part of National Kids and Vaccine Day. We will be hosting our pop-up event, Vaccination Conversations. This one-day event will feature presentations and roundtable Q&A with COVID vaccine experts, cutting-edge research on immunization in Canada, and more. Spots for this free event are limited, so register fast at childhealthcan.ca. And it's always great if you watch live, as your questions and comments really enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our Knowledge Exchange Network. So thanks again for joining us today. Thanks to Dr. Cohen, Dr. Orkin, and Brenda for this presentation. And hopefully we'll see many of you back here on January 26th. Bye, everyone.